Hi, thank you for joining us today. My name is Jana Meisler, Clinical Director at Mundlicka Healthcare. It's my pleasure to be here with Dr. Kevin Foster, Director of the Arizona Burn Center. Dr. Foster is a graduate of the University of Toledo Medical School. He completed his general surgery residency at the University of Wisconsin, followed by burn surgery and trauma research fellowships at the University of Washington. He completed his MBA from Indiana University. He is the Director of Burn Services for the Arizona Burn Center and the Director of Surgical Research. He is also a Professor of Surgery at the University of Arizona and Creighton University Schools of Medicine. He lives in Cave Creek, Arizona, with his wife, 3 children, and many animals. Dr. Foster, thank you so much for being here today.
Oh, thank you for having me.
For your current practice, what are the 5 characteristics that you look for in a burn dressing?
It's interesting because the importance of various characteristics of burn dressings has sort of changed and evolved over the years. When I first got into burn, we really had 2 things we were concerned with. We wanted to prevent infection, and we wanted to allow the wound to heal. And there were really just 3 sort of topical lotions and creams and liquids that we used way back when. And that's changed. And so now there are a whole bunch of other things that are really important. So, for instance, we think pain control is really important. We think ease of use is very important. We should be able to put a dressing on and then hopefully not have the patients and families need to deal with it. Control of exudate, and then obviously preventing infection, allowing the burn to heal well, and of course cost in this day and age. So that's 6, but those are sort of the big characteristics for us.
That's very interesting. Do you feel that Mepilex AG matches most of the top characteristics of the ideal burn dressing mentioned in the clinical evidence review?
I do. We're very fortunate because we're a big, busy burn center, and we participate in a lot of clinical trials. We have the opportunity therefore to try out a variety of different dressings. And it's pretty unusual for something new and interesting to be available that we don't try. Along the same lines though, we try to make sure we pick the best possible dressing for our uses. And we've been using Mepilex AG for I don't know how many years, and it definitely meets all of the characteristics that we want for a burn dressing, particularly in the outpatient arena, but also in the inpatient arena also.
So thinking about the article, Mepilex AG and the Management of Partial Thickness Burns, a Review of Clinical Evidence, what are your key takeaways?
Well, as we've already talked about, I think that Mepilex AG meets the criteria for an ideal burn dressing in almost every category. I think it's very easy to use, and it has good outcomes. I think that you find support for Mepilex AG with burn care professionals and with patients and with families. So those are sort of the real takeaways, is that it works and everybody seems to be really happy with it.
So with that said, do you feel that with the evidence of Mepilex AG, that the article makes a strong enough pitch for other burn care centers and clinicians to add that to their portfolio?
I think it does. I think that there's not a lot of evidence-based care in burn care right now. We just don't have enough patients every year to do big, huge clinical trials and get strong evidence-based protocols. But I think that this article makes a good argument for Mepilex AG in burn care. But the other thing that's, I think, really important is the burn community is small. We all talk to each other. And I know that most of the big burn centers in the United States have Mepilex AG as part of their armamentarium in taking care of burn patients.
A common theme in the references was decreased pain. How important is that to patient health and healthcare providers?
I don't think that people outside of the burn community really understand how much pain is involved with a burn injury. One of the things that I usually say to people is, think about when you burn the tip of your finger on an oven, and now multiply that by 1,000 or 10,000, and it's not going to go away the way that oven burn usually goes away after a few minutes. And that's what burn patients have to deal with. And that's magnified with dressing changes and exposure of the burn to the environment and manipulation of the burn. So if we can put something in place and leave it in place, that's really important. And pain control is always high on our list of everything we do for burn patients. We want that to be a very high priority. Number one, it's just the right thing to do for people, to treat their pain. But also, people take care of their wounds better when there's not a lot of pain associated with it. If there's pain, you're going to avoid that and you're not going to do the thing that needs to be done. So I think pain control is absolutely crucial for successful burn dressings.
So we talk about pain, but let's talk about anxiety. Does decreasing anxiety with that dressing change, does that play into what dressing you're actually putting on a patient? And how does that impact their overall experience?
So anxiety is also a big part of burn injury, and the anticipation of additional pain, of the unknown, can cause a lot of people to be pretty anxious. And that's part of what we do when we take care of patients, is not only do we treat their pain, but we also treat their anxiety, and that takes a number of different forms, both medication and non-medication. But I think that having a consistent dressing that's not going to cause pain really helps to alleviate anxiety in burn patients.
With dressings, do you feel that fewer dressing changes is more impactful for a patient?
Yes. Fewer dressing changes is definitely better for patients. First of all, the ease of care is better. It's nice if we can put patients in a dressing and let them go home for a few days and not do anything to that dressing, and then bring them back to clinic, and then under controlled circumstances with burn healthcare professionals, take the dressing down and look at the wound. The other thing is that pain control is better, and participating in physical and occupational therapy is easier if you don't have to continue to change dressing. So absolutely, it's a very important characteristic.
So definitely having a dressing that you can leave on is very important.
Definitely.
One of the references in the article mentioned lower costs of care using Mepilex AG due to shorter healing time. When compared to other dressings, do you feel that Mepilex AG is more cost effective?
I do. I think it is more cost effective. And I think you're right on with cost effectiveness as opposed to cost, because there are a lot of factors that go into the cost of burn care dressings. And I think one of the ones that we don't think about enough is time. Time that patients and families spend doing dressing changes, time that burn healthcare professionals spend doing dressing changes in clinic and in the burn center. And then every time you do a dressing change, you have to reinforce that dressing. You have to put on retention dressings and ACE wraps and things like that. So there's a lot of cost that goes into burn care. And to just put something in place and leave it in place, you sort of minimize all that extra stuff, including time spent on doing the dressing. And we've already kind of touched on pain, but that's another aspect of this too, is dressing changes usually cause pain, and oftentimes that requires pain management, which is another cost. So yes, I think that putting a dressing in place, leaving it in place, having the wound heal expeditiously really contributes to cost effectiveness.
So when we talk about cost effectiveness, do you feel that with Mepilex AG that it's both cost effective for a facility and a patient for home use?
Yeah, absolutely. The fact that you can see a wound in the burn emergency department or in clinic and put that patient into a dressing that isn't going to require much care or any care for the next few days, and then bring that patient back to clinic, that helps patients and that helps families. And in this day and age, oftentimes we can't give patients, if we're going to do a dressing that requires daily changes, oftentimes we can't give those patients what they need during a clinic visit. It requires them to either go out and buy things on their own or have a company deliver that for them. And a lot of times they don't end up with the right things, or they come late, so there are a lot of complications with that. So yeah, I think that doing things the way we do with Mepilex AG really contributes to cost effectiveness.
Dr. Foster, I want to thank you for joining us today, sharing your journey to how you became a burn physician, and also discussing the evidence on Mepilex AG. I also want to thank our audience for joining us today.